Hi, this is Tatiana Dyachenko, and today's video is about narcissistic personality disorder. And this is the flower narcissus, which is symbol of this disorder. In my practice, I deal with the relationship, and people ask me to help them to solve problems and to solve conflicts, and I have a lot of different methods and techniques for solving problems and conflicts. Some of them contact techniques, some of them distant techniques, and they are really effective methods. But there are some people with whom nothing will work, no matter how hard you try and how effective technique is. Communicating with them is devastating, and you need to use absolutely different methods to communicate with them. But first you need to understand who are they. And these people with personality disorders, and today I talk about narcissistic personality disorder and try to help you to understand what kind of people they are. The problem with them is that these people are very hard to spot. They are changing their appearance all the time and pretend to be normal. Especially at the beginning of a relationship. They are really good at masking and playing good guys. They're charming, generous at first, but later when you're committed to the relationship, they reveal their real faces. And victims can be so traumatized and be left with such a deep wound inside, which can ruin their lives. Some of them even attempt to commit suicide. Some of them are successful with suicide. It's really dangerous. This is why we need to know the symptoms of this disorder, indicators, markers, even hints of their behavior, and stay away from them. Don't be involved with them. And what is this term? Why this term is used in a clinical world? This came from the ancient Greek myth of Narcissus, like a flower. In this myth, a handsome guy falls in love with his own reflection. As a result, the guy stared at his own reflection until he died. And maybe this is symbolic for narcissistic relationship, because they try to find the perfect match but never succeed. The only perfect person is narcissist, himself or herself. And we used to think about narcissists as a people who are bragging all the time, taking selfies and posting on Facebook. But clinical picture of narcissistic personality disorder a little bit more complicated. And these symptoms you can find in DSM-5, Diagnostic Statistical Manual, edited by American Psychiatric Association. And to be diagnosed with narcissistic personality disorder, you need to have at least 5 of these symptoms. If it's only one, it's not enough. And these people, they are empty inside. And they need other people to fill this emptiness. They are dreading admiration from you. They're trying to manipulate. They exploit a relationship. And they create a grandiose image of themselves to have this admiration. And what is demographic in NPD? There was a survey in 2004-2005 in the US, face-to-face interviews with 34,653 adults participants in the Wave 2 National Epidemiologic Survey on alcohol and related conditions. And according to this survey, prevalence of lifetime NPD was 6.2%, with a greater rate for men, 7.7, than for women, 4.8. And NPD was significantly more prevalent among black men and women and Hispanic women, young adults, and separated, divorced, widowed, and never married adults. NPD was associated with mental disability among men, but not women. And it is high co-occurrence rate of substance use, mood disorder, anxiety disorder, and other personality disorder. And on my channel, I will explain each symptom and markers of narcissistic behavior and support it with a real life example. My recommendation, if you see the narcissist, don't stay in this relationship. Don't be involved, but if you are involved, run away as soon as possible and as far as possible. And this way you will save your energy and maybe save your life. I wish you a happy and healthy, harmonious relationship and strong boundaries. If you like this video, click like, subscribe to my channel. See you next time. This was Tatiana Dyachenko.